Good morning, everybody. I am Dr. Rahul, working as a senior resident in the Department of Emergency Medicine, AIMS New Delhi. So today we will discuss on basics of echocardiography, that is transthoracic views only. So first we will discuss about probe, that is echo probe. In adults we use low frequency probe, and in pediatric we use high frequency probe, as the cardiac system, that is heart, in pediatrics are superficial. An important thing about probe is that we have index mark, and we uses index mark in 2D echocardiography to make different views, and the position of the index mark is very important while doing 2D echocardiography. So why should we undergo a 2D echocardiography? To look for any abnormality in the heart, like any cardiomyopathy, any septal defect, walls defect, any abnormalities in the pericardium, any abnormal chambers, any abnormal structure inside the cavity, and the status of blood flow within the heart. So there is some approach to read 2D echocardiography while doing 2D echo. So we have to look for whether heart is beating or not. We have to look for any fluid around the heart or not, whether chambers are dilated or not, regional wall motion abnormality present or not, and how is the contractility of the heart. So this is the approach, and if you will go with this approach, nothing will miss. And if you don't follow this approach, then definitely you will miss something. So always go with this approach. So first we will see flex view, that is parasternal long axis view. So in this view we have to keep index mark at 10 o'clock position or towards right shoulder, and transducer should be at third or fourth intercostal space, and it should be straight up, and the position of the patient should be in left lateral position or patient should be in supine position. So this is Plaque's view. So, so in this view you can see left atrium, left ventricle, then right ventricle, and here aorta and aortic wall, and here mitral wall, and there is some structure inside the left ventricle, that is papillary muscle. So this is Plaque's view. So there are some points for the good Plaque's view. It should be straight, and aorta at should be 2 to 3 o'clock position, and left ventricle should be at 9 to 10 o'clock position, and USG beam should be at right angle. And at the end of diastole we have to measure some structure, and the diameter of this structure should be in normal range. If the diameter of this structure not coming in normal range, then there are some problem. So these structures are interventricular septum, left ventricle diameter, posterior wall diameter, right ventricle diameter, and the diameter of the left atrium and the aorta root and the right ventricle wall. And also we can look for the high Plaque's view to see ascending aorta. So how to make this view? We can move the probe one space up. Suppose if we are in third intercostal space, then just move to second intercostal space. And this view mainly used for aneurysm and the dissection and the extent of dissection. So now let us discuss about parasternal short axis view, that is P-sax view. So we can see P-sax view at different level, that is at aortic level, mitral wall level and the papillary muscle level and the apex level. So this is P-sax wave at mitral level. So in this P-sax, you can see mitral wall, then this is left ventricle, this is the right ventricle, and this is septum. And this wave is best for or to look for regional wall motion abnormality. So this is P-sax wave. And to make P-sax wave, we have to keep probe at second to fourth intercostal space, and the index mark should be at 1 o'clock position or towards left shoulder. Now let us jump into the apical 4-chamber view. In apical 4-chamber view, we have to keep probe at 5th intercostal space left side and just middle to the mid-clavicle line, and index should be at 1 to 4 o'clock position, and the chamber should be straight. So this is apical 4-chamber view. So in this view we can see the left atrium, then left ventricle, right atrium, then right ventricle, and this is septum, and this is mitral wall, and this is tricuspid wall. So this is apical 4-chamber view. Then this is apical 5-chamber view. In apical 5-chamber view, we can see left atrium, left ventricle, right atrium, and the right ventricle and the aorta. That's why it's called apical 5-chamber view. And this view is best for aortic stenosis. And then this is apical 2-chamber view. So in this view, we have to keep probe at 5th intercostal space, and the index mark should be 1 o'clock position, and you, you can see the left atrium, mitral wall, and the left ventricle. So this is left atrium, this is mitral wall, and this is left ventricle. So this is apical 2-chamber view. Then this is apical 3-chamber view. In apical 3-chamber view, we have to keep probe at 5th intercostal space, and the index mark should be 10 o'clock position. And in this view, we can see the left atrium, left ventricle, and the aorta. That's why it is called as apical 3-chamber view. Now let us jump into the subcostal 4-chamber view. So in subcostal 4-chamber view, we have to keep probe 2 to 3 centimeter below the sternum, and the index mark should be towards 3 o'clock position. So in this view, you can see left atrium, right atrium, then left ventricle and the right ventricle. So this is mitral wall, this is tricuspid wall, left ventricle, left atrium, right atrium, and this is right ventricle, and this is interventricular septum, and this is interatrial septum. So this is subcostal 4-chamber view. Now we will see about suprasternal view. So in suprasternal view, we have to keep probe at suprasternal notch and the index mark should be above, that is towards the head. And in this view, we can see arch of aorta, then descending aorta, this is ascending aorta, and branches of arch of aorta. So this is suprasternal view. So suprasternal view mainly to look for aortic dissection and aneurysm. And this is subcostal view for IVC. This is IVC, and you can measure the diameter of the IVC, and IVC is opening from the right atrium, and we can measure the diameter of IVC and we can check the collapsibility index. So by measuring the IVC diameter, we can find out the intravascular volume status. So by measuring the status of IVC, we can resuscitate the patient. So this is all about basics of 2D echocardiography, and in upcoming video we will talk about abnormal finding of 2D echocardiography. So thank you guys for watching this video.